using the microphones? Or
Yeah.
Hello, everyone. Thank you all for tuning in to our virtual ThreadLift event. I'm Irina Litvin, nurse practitioner, and we have the talented Dr. Mira here with us, as as our patient, Jan, that will be here with us, sharing her experience with you tonight. Also, at the end of this amazing question and answer thread lift, Dr. Mir will be giving away one free thread lift to one lucky person. Comment your name below for a chance to win, and the winner will be announced at the end of the event. So make sure to stay tuned till the end for your chance to win a free thread lift, which is a $2,500 value. Here today, we would like to welcome everyone, where we'll be learning all about thread lifts, what they are, how they work, and what they can do for you. So stay tuned. So we'll go ahead and get started. So I'm going to start with asking Dr. Mira some questions. So let's just start with, what is a thread lift and how does it work?
Well, thank you everyone to tuning in today. And today, of course, we are focusing on thread lift. So we have a lot of non-invasive, the treatment, non-surgical, non-invasive treatments to anti-age and enhance our looks. We have filler, we have neurotoxins, which is Botox, Dysport, and the lasers. And this is like a fourth pillar, which is the threads. As the name suggests, they're tiny little threads. And with them, what we're doing, we are kind of lifting the tissue of our face, which can be kind of a problematic with time, with the gravity. So we can use it to just kind of lift and reposition to our tissue to a higher place where it's supposed to be before like a couple of years.
Good. So, and for some reviewers may ask, what areas can thread lifts be placed besides just like the cheeks area?
Yeah. So, well, for like just simplicity, we divide our areas like upper face, lower face, neck, brows, or the forehead. People are doing, or it is done on other body parts too. Like we can do on décolleté, on the abdomen, on the knees. So wherever we have laxity and we want to lift the tissue, we can use it there. But it kind of really works on kind of a face where the people are just have a little bit skin and want to look youthful.
And one of the questions that most people ask is, how soon can we see results?
Yeah. So when we chew the threads, we see definitely immediate lift. And then we can have some swelling there. So it takes like 2 weeks to 4 weeks to completely settle in. But you're seeing like completely immediate lift. And depending upon type of threads like PDO or PLLA, it kind of varies the duration too. So it's kind of a 6 months to 2 years, depending upon how many threads we put, which type it was, and kind of the type. So
yeah, you answered the other question, which is most people want to know
the duration.
How long do they last? Like, what can they expect?
Yeah.
And once they do get it, how often would they need a touch-up or like a maintenance, or what would be the recommendation for their next treatment?
So that's a really good question, because both of the side of our face are sisters. They are not identical twins. So one side sometimes need more love and care, that means need little touch-up, and which we can do as early as 2 months or kind of 4 to 8 weeks. But you can be retreated again as like fillers, depending upon which area we did, to like an average is after a year. You can kind of repeat this process. And when they dissolve, they are building your own collagen. So these sutures are the same which we used in surgery, where we kind of approximate the skin from the top or inside the human anatomy to, like in the heart surgery or abdominal surgery, any surgery you want. They are same sutures. We kind of leave inside our body, and body kind of reabsorb. So for that, we have our wonderful Jen here. She just got our thread lift done. And you did like upper face and I think a little bit of brow.
Mm-hmm.
So I will let you share your experience. How was it?
Well, first of all, I'm so glad that I got it done because not only do I think I look 10 years younger, it makes me feel better about myself. I feel 10 years younger. I can actually feel the lift in my face, and I love that feeling again. I think I actually thought that the whole procedure was going to be a little more painful or, involved. And the way, of course, Dr. Mira has everything and her staff here does such a wonderful job of making you feel relaxed and comfortable. They talk you through every step of the way, what to expect next. And I was pleasantly surprised at how well everything went. And
I'm glad to hear that. She look amazing? You look amazing. And it was
show
like
some before and afters of
Yeah.
what
that
our
would be
patient Jan looks
fun.
like.
Yeah.
And I'm glad you shared a little bit about like the painful, because a lot of patients want to know, is it painful? What would you say as far as like pain level for you?
Well, you can feel some things, but it's not like, I wouldn't call it pain. There isn't any pain. It's just a little discomfort here or there. It's a procedure, but I just couldn't get over how quickly my face healed. Like even where, I'm not sure what you call the little, where you put the
entry points, yes.
Points. Though they seem to have healed up like really fast. And I don't know, I should have asked more questions possibly ahead of time. Like, am I going to have bruising or anything like that? And
yeah, you look amazing. And how many days?
I didn't have anything.
And how many days you're after today?
It's been 7 days.
Yeah, that's amazing. And you cannot tell, like you can absorbly looks amazing. So
actually, like I went home and I'm going to be honest, I told my husband that I was going in for a facial.
Isn't that great?
I walked in our door and my husband goes, "Wow, that's a great facial. You look 10 years younger." And he really had no clue. And to this day, he has no clue that what exactly I had done. But he supports me in anything I do to help myself look better, whether it be skincare or whatever I need to.
Isn't that amazing?
Yeah, I have a good husband. So.
Yeah, that's great.
Yeah.
That's like, and I mean, I'm so glad he supports that. But again, like it's our personal choice. We do it for ourselves, isn't it? Yeah.
Yes, it is.
And so as you can see, like Jan here is like only 1 week out, looking amazing. And you're kind of pretty to start with. And if I don't know if you want to mention, like, how old are you?
I'm 67.
Isn't that great?
Yeah.
I'll be happy. I'll be like, really, if I can look like you at your age.
I'm a grandma. Actually, I'm a great grandmother now. And, but we don't have to look it. We can look better than our age, especially when you have a wonderful friend and Dr. Mira. She's done, through the years, I've had like an IPL and some other things just along the way. And I've built up such a confidence in your skill level and your care that I was so comfortable having it done.
I really appreciate that. You're going to make me cry.
No, really, I'm sincere about that. When you go in someplace to have anything done, if you don't have confidence in your physician or the technician that's actually doing it, the work, it can make for an intense situation and possibly not as good of an outcome. And I've learned to trust your judgment, to trust you in whatever you suggest. You recommended this was going to be the best bang for my buck, so to speak, if I just would do these thread lifts. And I listened to you, and I'm so glad I did.
Well, I'm
because-
honored.
yeah.
I really feel appreciated because you're trusting me with your face, which is
Yes.
like your most important thing.
Yes.
So I feel honored every time, and I try it my best like it's my own face. So that's kind of a really, really amazing that, you're sharing, and I appreciate your trust.
Well,
Definitely.
it's the truth.
And then somebody's saying
honest
like,
truth.
it's Brenda. Hey, Brenda, that you suffer from migraine. With the Botox, yes, Botox do help with migraine. We do Botox not only to kind of help relax lines and wrinkles, especially in the middle of the eyebrows, and that helps in the migraine too. So we do that for that. It kind of solves the both purpose, migraine and like wrinkle relaxer or smoothness. But neurologists can do for the migraine too. But we don't go like do the full treatment, like inject going around the sometimes you need in your neck or in your scalp the full migraine treatment.
Right.
But definitely Botox is a well-known FDA-approved treatment for migraines.
Good question.
Yeah.
And Jan, and everyone can see here, Jan, she's a week out. Look how great she is looking. And she touched a little bit on it, but I wanted to see if you can share a little bit about your recovery time. Like here you are 1 week out looking great. A lot of times people are concerned as far as like how much time did it take off, or what would you tell our audience as far as recovery time, or how was your experience with that?
Well, I can tell you, honestly, my husband didn't notice anything at all.
That's great.
I noticed myself a little more swelling
Yeah.
in the very beginning, and of course, luckily the way I wear my hair brushed forward, the little band-aids. I had skin color band-aids right around where the little entry points were, and I had to leave those on for 24 hours, and he didn't even notice the band-aids actually. But that was a simple thing. So I would say not even like the 24 hours, maybe, if you didn't want anyone to see your Band-Aids, that you had something done, because I was out walking my little dog the next day and smiling at my neighbors, and they all just looked at me and smiled. So they probably thought, wow, she looks refreshed.
Yeah, that's great.
Yeah.
And when I had, mine, so we kind of doing this technique now, which we kind of lift your skin to your scalp. It's called ponytail or reverse vector technique. Mm-hmm. And I have some like before and after, if you can pull that person and before and after. So that is like covered with hairline. So you don't have much downtime because the entry points are, as I said, is covered by hairline, but you can say how much lift you can see right there. And so you don't look that kind of a swollen or anything, but you can have this like soreness where like in my scalp I felt for like a week or two, and I have to take like Tylenol extra strength the first 24 hours. But if you see her other side, what you can see like on the like the lift and the volume in the cheeks, the brow lift, and kind of we just did tiny bit lifts to the lips are a little bit swollen, but that looks amazing. And it's looked pretty kind of a natural too. So that's the other thing we like. So you can see that little bit undulation of the skin, which kind of goes away. But we can combine this treatment with the filler, or to kind of the volume loss, which we can have in our temples, around our cheeks. Mm-hmm. And we can combine this treatment definitely with the Botox or whatever neurotoxin we are using for sure.
That can be done in the same visit as well. So
yes. Yeah.
You can definitely do all those in the same visit.
I didn't even take any Tylenol. I didn't feel like I needed anything. It was a little discomfort, but if I felt something, I put a little bit of ice, and then, you feel like a little bit of weirdness. I don't know how to say, like a little nerve thing up into your head, right there.
Yeah, like twinges.
And I just remind myself, oh, it's working. It's working.
Yeah, the same thing I feel for a couple of weeks. Yeah. And Rosie is like asking, I think she saw the video when we are applying something on the skin. So we were just cleaning the skin, and after that we do apply a little bit topical numbing That's what it was. And then we also use some like little injection to completely numb. And we also have Pronox here. So we give your experience more relaxed, least painful. So that's what we're using during the video. So, yeah, so this is just applying the numbing little bit before the treatment. And that was we talking about the Pronox. Pronox is the little gas you can inhale, which decrease your pain and anxiety. It does have very short effect. So Jen, kind of right after was ready to drive. It only remains in your system for just a couple of minutes. Really, really good. You can ask in our office if you want to add this on. You can add it on before any laser, like Halo or Morpheus 8, thread treatment, any filler treatments. You can definitely use it. So it's very popular in our office.
It's just a way to make your treatment a lot more comfortable. And you just feel a little bit more like lighted, more lifted, not as edgy. So it's definitely highly recommended. Like Dr. Mira said, for fillers, any of the laser threads. So just ask our office if you're interested in that.
Yeah. So again, coming back to our threads, the amazing threads. They're getting popular by the day. It's a lot of techniques to do it. There are a lot of areas we can do, and there are type of threads. We have Silhouette InstaLift, which is PLLA, different material, which Sculptra is made of the same thing. They kind of use as like shelving or scaffolding for your own collagen, and your collagen grows as your body dissolves this. And PDO is polydioxide is another material we use, and there's another like PCL coming. I'm not sure it's in the market yet in this. So there are a lot of new methods are coming, but again, we have to make sure it's solving our purpose. It should look natural, number one. It should be do what it's supposed to do, make you look beautiful naturally. That's kind of definitely our main goal here, is to make you look natural.
And
we don't want to.
Yeah, and you can kind of see with Jan, sometimes I get a lot of questions, does it look natural? Or people are wondering, and Jan here is just a perfect example of how just 1 week out, how natural she looks. So it's definitely a very natural look. And we can see some before and after photos of how it looks. But we have a question right now of Lydia. She was asking, was her brow lift done with threads or Botox?
So we just did threads so far. We are going to do Botox. So this, you can see the lift. It is just with the threads. So you can lift a little bit with the Botox too, but not like this is like more up to 1 centimeter, which you can use thread, but we always a combination works the best. So we are planning to do Botox around the eyes soon.
I noticed a difference when I went to put makeup on today. I had several other appointments earlier today, and so I went ahead and put my makeup on this morning. And as I'm putting the eyeshadow and stuff, I'm like, boy, my eyes really are lifted. Like I could see in through to my crease easier to put my eyeshadow in there and everything. So yeah, it's little things like that you notice. But I wanted to just share with anybody that is doubting at all about, like I've seen people who have had things done, and you look and it's like a little scary because it's so dramatic. Dr. Mira always, that's why I mentioned about trusting her, because she always wants you to look just naturally refreshed and brought back to your own look, like I used to look a few years ago. And that's, I think, is a nice look for you, something that's natural and just going kind of reverse aging.
Right. Like so somebody look at you should not say you have done anything. You just should say, "Oh, you got a nice haircut," or
you look good. You look rested.
You're rested.
Yes. I've had a lot of emotional things happened in my life in the last few months, and I could see it in my face. I was just really drained, and I just really needed this to help bring me out of that. depression, of all the bad things that can happen in someone's life, and then to be able to experience something like this, it just has helped lift my spirits. So thank
That's
you
so good
again.
to hear.
Oh,
Thank
well,
you.
you were a
Thank you.
fighter. You were doing great. I saw you
you for
came from office a couple of months ago, but you're doing great. You're a fighter. You're doing it. You're amazing. So yeah, I'm just doing a little bit tweaking, but it's all you. It's
And we
all
have
you.
a question from Brenda. How long is the procedure?
So procedure takes like half an hour or less. Between like coming here, we have to do some pictures, paperwork, a little bit numbing. So it all takes half an hour to 40 minutes. It's done local anesthesia. So it takes the same time as you're doing filler. So yeah,
And
that
if
is.
anybody has any questions, you can go ahead and comment below. We'll be answering questions, as you can see. And Sarah has a question: are the threads painful? I think we touched a little bit on this already, how we do have different methods to make treatment more comfortable. Some of those methods we talked about, we do topical numbing, and we also have the Pronox, which helps with the comfort level, making your treatment more comfortable. But Jan, I know you touched a little bit on that, but you want to go ahead and let us know a little bit more?
I was really pleasantly surprised. I guess I didn't really know what quite to expect, but that I did opt in for the Pronox, and that was nice because it was something that I could control. Mm-hmm. And I felt like I was not really experiencing pain like I mentioned in the beginning. It was just a little weird feeling, but not pain. And then immediately after, for the first few days, it was maybe sore, and a few places where you want to touch your head or whatever, it was just sore. Mm-hmm. Like you had like a small bruise, but there was no bruising, which was nice. And you can't expect to have something done without some kind of different feeling. But again, I was pleasantly surprised at how simple it was and how quickly you were able to work. And I think using that Pronox too, where I was more relaxed, it was easier for you to do your job quicker and more efficiently. Yeah. And
one other thing for pain comfort, we do local numbing as well before we go ahead. Dr. Merrick does the threads. We have another question from Charlotte. Do the threads dissolve?
Hey Charlotte, they do dissolve. So that's why it makes them like pretty safe, and that's kind of easy. So there was one time the threads which were called Silhouette Lift, not Insta-Lift. They were not absorbable, and they were not changing with people's face. Like 10-20 years, our face changed a lot. Our fat pad shifts, but the threads were giving like some undulation, some issues when thread will broke. So these threads are completely dissolvable by your body. Even if the threads break by any chance, which is rare, we just leave it there, and we can put one on top of it so that it just giving collagen production. It is working like a filler in your face. So Sarah's asking if there is any downtime after the procedure. So with our new technique, which is called ponytail or reverse vector technique, our downtime is minimal, but I will say Jen was able to kind of work and go out next day, but there was some swelling, some soreness that kind of happened. My soreness stayed for definitely for first and 2 weeks. The soreness is more, which I have seen when we are working on the jawline and the neck. It is minimal when we work on the upper face.
Well, great. If anybody has any other questions, please ask us. Also, just a reminder, please leave your name below for your chance to enter to win the free thread lift.
So we're going to do the draw real quick, but today, because we're focused on the threads, we're doing amazing spatial. So if you can elaborate over that, so who are interested.
All of this, a lot of people are probably asking, how much do thread lifts cost? So for this event and limited time only, we are doing a special of buy one area of threads and get the second one 50% off. So that's $1,250 savings, but it'll only be limited until March 31st of this year. So just the end of this month.
So the thread lasts up to 2 years, but people kind of do have to repeat or do some touch-ups like after a year or so. And it's also depend on your age, your skin condition, how much skin we have. So some people are ideal candidates. Ideal candidates are somebody who's in their 40s, 50s, has a little bit skin, and they're not ready for facelift or doesn't have enough skin for the facelift. Thread lift does not replace a facelift. But some people who are just don't want facelift for whatever reason, the cost or the recovery or the scars, we can definitely do thread lifts. We have definitely improvements, but it depends upon if you have too much skin, we can't just lift it all. There's another amazing example for the combination treatment, which we did filler, some threads, and the toxin for this amazing, beautiful woman, and she looks amazing. So this is like how we can transform and you look yourself, but a couple of years younger. So as I said, one treatment is not question of everything. We do customizable treatment because every face is so unique and different, like how much filler and where we have to put it, the same thing without toxin and kind of a thread, the combination does definitely the magic. So it is by the thread on the neck is just one area. So it takes like 8 threads, 20 threads. This is our problem. We just want to give you the optimal result. So that's why we don't sell our threads by the thread, like 1 thread, 2 thread. We sell the thread by area. So the one will be the area. And as Irina just said, we can do neck and upper face. So if you're buying upper face, your neck will be like 50% off, or any kind of 2 areas we can use.
So the most common areas we're doing like upper face, meaning like the cheek area, also lower face, like the jawline area, and then there's the neck area as well as the eyebrows. So good. I want to say thank you so much, Jan, for being here and sharing your experience.
Yeah, I do appreciate your time, and because it means a lot to me that you did this. I really thank you.
Well, I just wanted to invite everyone to please just come in and sit down and have a chat with Dr. Mira. She will be honest with you and tell you exactly what she feels would be necessary for you to give that uplifted, natural look for your face. And that's what you did for me. So thanks again.
Thank you.
So it's time to select a winner.
Okay, so we're going to do a live drawing.
Yes.
So if you can have this.
We'll have Jan pick out a random name. Sure. So we'll go ahead, we'll bring in the pool. Go ahead and stir it really well and select one lucky winner. Let's see who it's going to be.
This one. Jenny.
Wow, congratulations.
Congratulations.
Congratulations
to
our lucky winner. You have just won a $2,500 value treatment. So we'll be in contact with you with all the details for that. So if nobody else has any questions, this will conclude our event today. I want to say thank you all for being here with us. And I would like to say thank you.
Yeah, so can you just, I want to say for how long we are extending our, the event promotion so people can have some time to think over and do the consult. So is it like a week what's
until March 31st.
Okay, great. So we have a week. So whoever is like thinking that if that's the right treatment for them, we can be welcome to just stop by, do consult with us. Yes. Our consult is completely complimentary. So let us know. But I thank you again.
So thank you, everyone. And I also want to thank Dr. Mira for taking her time to do this question and answer, taking time out of her busy day. So we look forward
congratulations to Lydia again.
We look forward to seeing all of you guys for a consultation.
Bye.
Bye. Thank you.